DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. Excited about the show today. We're going to have Dr. Dave Rethorst with us, and we're going to talk about some of the things you're going to do at that spring turnout or turnout processing of calves, cows, and your pre-breeding shots for the bulls and the cows. Thanks for joining the show. More after these messages.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hey folks, welcome to DocTalk. Dr. Dave.
Good to be here, Dan, as always.
Folks, this is my friend and colleague, Dr. Dave Rethorst. And Dr. Dave is the Outreach Veterinarian for the Veterinary Diagnostic Laboratory here at Kansas State University. And he's one of those people that we call on for expertise in beef cattle area. All things cows and calves and bulls is Dr. Dave's subject expertise. And 30 some years.
38 years since I graduated.
That's cool. So a lot of experience is the way we like to phrase it. Dr. Dave, you know, when we talk about cows and calves, we're going to talk about turnout processing and branding programs, folks. But Dr. Dave, you know, we've got some checklists. Just let's go through the annual checklist. We got calves, we got cows, we got bulls.
Okay.
Kind of the things that producers are going to be thinking about first of the year, springtime, fall.
Okay.
What are we working on?
Okay, well, you know, right now we're getting all these cows calved out. So here in a couple months, you know, we'll do that turnout processing. We need to think about what vaccines we're going to use, preparatory for weaning. We'll come back, we'll do some other things preparing for weaning this fall, and get those calves ready to go to the feed yard.
So those calves, we're going to calve them out first of the year, come back 2 to 4 months, time that spring processing turnout, then they're going to go out on the pasture with mom.
Yep, absolutely.
They're going to be out there till they're 7 months old, come back in, and we're going to wean them.
Then we're going to wean them.
Now what about the cows?
Cows, you know, again, we'll do some of the vaccinations when we get done calving, preparatory for breeding season. Come back when those calves are weaned, we'll preg check those cows, find out which one's going to be mamas again next year. And then go on those that are pregnant, then we'll come back and process them again many times right before they calve.
Okay, and you'll do that just kind of like a pre-calving, kind of that colostrum boost to get a better passive immunity to that calf.
Right.
Okay, and then the old bulls.
Senior bull.
That's right.
You know, this time of the year, they're just out there eating. It's time to start thinking about getting them ready. We'll do our breeding soundness exams, many of those going on right now. Some vaccinations, get the bulls ready to go out and do their job for 60 to 90 days.
So when we're doing spring turnout, that's when we're going to start doing our breeding soundness exams, making sure that the bulls are fertile and available for breeding. Turn them out. body condition score usually around a 6 when we
5.5 to 6
when we turn those bulls out, and that's it. So calves, cows, bulls, and obviously you want to vaccinate your bulls for your venereal diseases and things to that nature, the pre-breeding vaccinations when we semen test. When we come back from break, Dr. Dave and I are going to jump on this branding or turnout processing for these baby calves. We're going to talk about cattle handling, preparing them. Thanks for watching. More after this break.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Kevin Jock grew up on a 90-cow dairy farm in Livingston, New York. After the family farm was sold in 2006, he decided to become a large animal veterinarian. Kevin graduates in May of 2016 from Ohio State University, and soon after will begin his veterinary career at Country Road Veterinary Services of Apple Creek, Ohio.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hey folks, Dr. Dan here, and I want you to join us in Kearney, Nebraska on May 11th for a stockmanship clinic. We're going to talk about how to work cattle in teams. We're going to talk about cattle handling techniques and much more. Experts from across the country are going to be there. Dr. Tom Knopfsinger, Kurt Pate, Ted Howard, Kip Luga-Savage, myself, many more are going to be there to work with you on this clinic. Go to packdvms.com to get the agenda and to register.
Parasites will lose you more money than any other disease out there besides infertility. So, parasites is something that we have to control, and that's what VetGun does for us. It's tough out there on a ranch, but with the ease of the VetGun, it's a one-man operation, and whenever you can get one thing to work out great throughout that day, it just makes my life a little easier.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst. And we are here at Kansas State University's College of Veterinary Medicine, where Dr. Rethorst serves as the Outreach Veterinarian for the Veterinary Diagnostic Laboratory. 38 years of cow-calf and feedlot production medicine and individual animal medicine practice experience, and someone who just has a true passion for the beef industry, the veterinary profession, and things that we do. And so we're going to talk, Dr. Dave, about vaccines first. Let's jump on what do we, and folks, remember this, always work with your local veterinarian. Dr. Dave and I are going to give you some general kind of core vaccine strategies. There will be others out there that your veterinarian knows your cows, knows the geography, knows the epidemiological survey of your area. Yes. But we'll just visit. We'll just visit.
Yep. Give our preferences.
That's right.
Then they can discuss it with their veterinarian.
Don't get us hung up now. Okay. So let's talk about vaccines. What kind of vaccines are you looking to give these baby calves at branding?
Well, I start off, the viral vaccination is as important, if not more important to me than the blackleg. And the blackleg's pretty important. But we want to give that blackleg.
So walk me through the antigens in that viral vaccine.
We can go simple or we can go complex. The basics that I really want to see is an IBR and a BVD. Now, we can add BRSV and we can add PI3 to that, and in most cases, those those are added, and by the time you throw the second strain of BVD in there, that's where we get our 5-way modified live vaccine.
And you are using modified lives on these baby calves?
Yes,
Okay.
I do recommend modified lives on these baby calves. It does a better job of priming that immune system, getting ready for fall.
And I do too. And so we're going to look at that 5-way modified live viral, and then blackleg.
And then blackleg.
Now, some of these people, this might be the second blackleg vaccine?
It could be the second blackleg. There are some people that give a blackleg at birth when they tag that calf, trying to shut down some of these enterotoxemias, these abomasal ulcer type things.
And if you have a pasture that is, there are blackleg pastures and non-blackleg pastures. And
Absolutely.
And so if you have had cases of blackleg, we really recommend that you get that vaccine in those calves at birth, follow up at branding. Other vaccines?
An awful lot of pink eye vaccine used on these spring turnouts. People use it. I sometimes question whether it's worth the dollars we spend on it. I think we ought to spend that $1.50 a head on fly control, and we'd be better off, but each to their own.
Right. So when we come back from the break, we can jump into some of that fly control and, fly tags and things to that nature. But the 3 big vaccines we're going to do: 5-way modified live viral, a blackleg, and potentially a pink eye.
Absolutely.
Great. When we come back, we're going to talk a little bit more. We're going to talk about castration. We're going to talk about steroid implants. You're watching DocTalk. Dr. Dan, Dr. Dave, Kansas State University. More after these messages.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA tip of the day is proper implanting technique. It's a really important implant that we give these animals at arrival or delayed implanting, whichever it may be, is that we do a proper job of doing it. Implants today give you a rate of return of about $30 to $60 and sometimes up to $80 pending the implant. And so it's just really important that we get that implant in correctly. It's really important that we have disinfect the ear on arrival. So if we have a clean bucket for just the initial wash, and then disinfection for just a final scrub, and then we actually have our implant gun where we have the disinfectant that we should always change that disinfectant every 200 head or in between pins and keep that fresh. And then disinfect your needle each time in between each animal. If you skip off the ear, also disinfect that needle. Don't just go on an implant. And so that's your tip of the day.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease, with the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. TrueTest Group, Weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Dave Rethorst. Dr. Rethorst is the Outreach Veterinarian for Kansas State University's College of Veterinary Medicine Veterinary Diagnostic Laboratory. 38 years of bovine practice experience and just a wealth of knowledge. Lucky to have him as a colleague and a friend. But one of the things I want to make an announcement that we're going to start doing here on the show, and you can see here on the set, we're going to build some shelves, folks. And what we're going to do on these shelves is if you will send in or mail in your ranch cap, we're going to start highlighting different ranches and the caps along the back of the set in the studio here. Just something we want to do to help recognize you folks that are out there watching the show, and you know, now keep it clean on the front. I mean, not it can have manure on it, but I just meant on the verbiage on the cap. All right, some of y'all have some creative names, and so anyway, let's it'll be fun, and we'll get you some information to mail those in or email us, and we'll shoot you out the address. But it'll be a lot of fun. Now, Dr. Dave, we've vaccinated the calves. What are we going to vaccinate the cows and the bulls with?
Okay, again, we've got to reduce that viral pool in the cow herd if we're going to cut down respiratory disease in these calves and cut down antibiotic use. You know, it's kind of a big vicious circle, Dan. So I like to use, particularly in the younger cows, a modified live 5-way viral on these cows pre-breeding.
Okay.
We've got, after that IBR, we're after both strains of BVD on that. We also need our Vibrio vaccine and our 5-way lepto vaccine.
So 5-way modified live, IBR, BVD, type 1, type 2, BRSV, PI3, followed up with that lepto Vibrio.
Yes, sir.
Vaccination. Any other vaccines for those cows at this time? Again, maybe the pink eye, but the jury's still out.
Yeah, jury's still out on the pink eye vaccine. You know, we've had an awful lot of trick in the state of Kansas in the last few years, not quite so much last year compared to 13. It's still out there. There are some people using that vaccine. Jury's still kind of out on that one too. It will improve pregnancy rates a little bit, but it really doesn't get it out of your herd.
Same vaccines for the bulls?
Yeah, except the trick vaccine. Trick vaccine is not approved. The work hasn't been done on trick vaccine in bulls, but the IBR, BVD, Vibrio, lepto on the bulls, maybe pink eye.
Cool. And so basically same vaccines, cows, calves, bulls, but the calves will get blackleg instead of the lepto Vibrio.
Yes.
Good solid vaccination platform. And then that leaves us, folks, with what we're going to finish on those baby calves. And basically, it's just castration, dehorning, and disbudding, right?
Right.
Or, I mean, implants.
Implanting.
And deworming, a lot of people will either deworm at branding.
Right.
Or wait until June.
Yep. Some people I've worked with over the years will use an injectable on those babies when they're doing the rest of their processing. Some of them will wait and, you know, use like an oral product through the mineral, through the feed in June. You know, that strategic deworming, trying to keep the pastures clean.
Well, this is some great information. Let's take a break. Folks, when we come back, we're going to talk more with Dr. Dave about pre-turnout processing of cows, calves, and bulls.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Hi there folks, I'm Dr. Dan Thomson. Are you Beef Quality Assurance certified? If you work with cattle on a regular basis, you should be. Beef Quality Assurance has been around for 30 years, and it has been the cornerstone for producers to learn how to provide safe, nutritious, and wholesome beef for our consumers. Today, our friends at Boehringer Ingelheim Vet Medica have generously supplied an online training program at bivi-bqa.com so that you can become BQA certified online at no cost between now and April 15th. Beef quality assurance is about empowering people. It's about taking responsibility for the beef that we produce, and it's about providing the proper training on farm on things such as cattle handling and animal husbandry. Go to the website, bivi-bqa.com. Get BQA certified today, thanks to our friends at Boehringer Ingelheim Vet Medica.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to DocTalk. Dr. Dan and Dr. Dave, Kansas State University, where Dr. Dave is the outreach veterinarian for the Veterinary Diagnostic Lab. And let's clear up the deworming real quick. Some people will deworm calves, most don't.
Right.
At Turnout.
Right.
Some will deworm cows with an injectable at Turnout because we haven't caught.
Right.
And then the strategic oral safeguard fenbendazole type deworming in the summer.
Right.
Okay. Now, when fly tags, and I know that this is another one of those controversial things, but we got to, the best would be to put them in later in summer, but we got to do it when we got them caught.
Right. And a lot of fly tags go in at the time of this turnout processing, and I understand that. It's better than not at all. But most of those fly tags have a 2 to 3 month window. So if you're going to handle cows, if you're changing pastures, going by corrals the first part of July, that's the ideal time to put in fly tags because you're going to have the most bang for your buck.
Gotcha.
with those tags. But if that isn't an option, get them in now. Use the oral larvicides, that sort of thing. But let's get a handle on the flies.
All right, now, we've had Dr. Reinhardt on here talking about which steroid implants to use in these steer calves, and we've covered suckling implants for heifers. If you know they're going to be breeding heifers, don't implant them.
Right.
If you don't know, if you do it at 1 to 2 during branding, you'll be okay with a low potency implant. But what about the importance of castrating these calves at the time of branding?
I think it's absolutely essential to castrate these calves as babies. It's less stress on them as babies than it's going to be at weaning. We can help cut down on some of our respiratory disease stuff because of that stress. If we look at, castrate, put a low potency implant in them, those calves 30 days post weaning are going to be heavier than a bull calf that's castrated at the time of weaning.
Oh, big time. And I think people don't understand that there's no advantage to leaving the testicles on for performance prior to puberty.
Right.
Until we have puberty, we don't get testosterone production, so there's no advantage, and there's a huge disadvantage to performance and stress.
Absolutely.
Well, As always, my friend, great information. Folks, hopefully you got a better appreciation for the annual cow herd flow, got an appreciation of what we're going to do at spring turnout and processing for the calves, for the cows, for the bulls, vaccines, castration, steroid implants, lots of things going on. Remember, always work with your local veterinarian. And if you want to know more about what we do here on the show, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson. Thanks for watching Doc Talk today, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.